Okay, so definitions. Asthma is a disease that causes your airway to close and more mucus to produce. Makes it breathing difficult or impossible. And the next one is where the airway will close, closing up your trachea and your bronchi that squeezes and you can't breathe. And the last one is inflammation, where the immune cells that fight viruses will come and make fluid clogging up your airway. Okay.
Oh, I know that one.
Yeah.
That's transitions.
Okay, symptoms. Asthma causes shortness of breath, coughing, wheezing, and/or chest pain. Okay, etiology. What causes asthma? Asthma is a disease that people are typically born with, and it is not contagious, although it can be acquired later in life. So if you do bad things to your body like smoking, or if you're always around somebody who smokes, you could acquire asthma. And those things are called triggers. And triggers are things that cause asthma to worsen. Some triggers are allergens like cats and dogs. If you have a lot of work and a lot of pollution, smoking, and certain types of medicines, weather, exercise, stress, cold air, strong odors, and one of the most interesting that I thought was cockroach poop. That can also cause asthma.
Cockroach poop?
Yes.
How tiny?
Okay, how likely are you to have asthma? And increased risks include, if you're a smoker, you can acquire asthma, or you can make your asthma worse. If you have a family history of asthma, so if your mom had asthma, your dad had asthma, you probably have asthma. If you have a mother who smoked while she was pregnant with you, you probably have asthma, or you might have asthma. If you're being always exposed to secondhand smoking, so if you're always around somebody who smokes, you could have asthma. If you live in a polluted area, you could have asthma. If you're in an environment that has irritating chemicals or fumes, you could have asthma. And last, if you have allergens, you could have asthma.
Like a lot of
Oh, dang it, I'm on allergy season.
Okay, so
Oh,
also an interesting fact was 13% of black children have asthma, 8% of white children have asthma, 8% of Hispanic children have asthma, and 12% of American Indians and Alaskan Native children have asthma.
Why is it both of us are the highest percentage?
yeah.
Me and Kelsey are American Indians and black.
Okay, diagnosis. How did doctors discover you have asthma? First, she'll ask you and your parents lots of questions to get medical history. Then she'll do a physical exam and listen to your lungs. She may do an oxygen level. She will check your breathing. She will do trigger tests, so she'll inject things into you to see how you react, and she'll do sometimes she'll do X-rays to see if it's a different problem that you have, and last she'll treat you like you have asthma, and if you get better, then you have asthma. Yeah.
Oh,
Okay.
don't miss Sevens.
What happens during an asthma attack? Remember, asthma is a disease that causes your smooth muscles to close in the airway. They get thick and they close. Increased mucus production, which clogs up the airway, and inflammation, which was where the viruses that fight, the immune cells that fight viruses come and clog up your airway. Okay, complications. Asthma can interfere with your life in many ways, such as it will sometimes result in frequent hospital and emergency room visits. There will be more doctor clinic visits. You have to remember to take your medications and dealing with side effects of the medications all the time. You'll have limitations to your activity time, because it will make it harder for you to breathe if you always do basketball, and you have to limit that. Everyone worries about you, so you may have less independence, because it will be like wanting to go out with your parents, and then you might have an asthma attack. So if you have a lung infections will happen to you more often because you have asthma, and then you miss more school days and more extracurricular activities.
Do you have asthma?
No.
Okay.
I do not.
What you did.
Same.
Okay. Complications. Status. This complication can be life-threatening. This is when an asthma attack turns into a very serious attack. It is when asthma worsens, where the airways close and they will stay closed even after the doctor has treated it. So,
Whoa.
yeah.
Okay.
So that's when you die from an asthma attack.
Okay.
How is asthma treated? For very mild asthma, there are inhalers. Just for when you're just feeling when it's hard to breathe, you don't have to go to the hospital. There's just inhalers. For more serious types of asthma or asthma attacks, there are injections that you can have and pills. And for even more serious asthma attacks, there are even more complicated or serious pills that you can take for that kind of asthma. And for very serious asthma attacks, you would go to the hospital. And last.
Honeycomb.
Okay, medications. There are 3 types of medications. There's beta-2 agonists. There are anticholinergic, and there are anti-inflammatory. Those are 3 types of medicines that will help with the different kinds of asthma attacks that you're having. Okay. Their lifestyle remedies. Obviously, you want to avoid your triggers. You want to use the air conditioner because it will filter out the outside allergens. It will, don't build up dust in your home. Keep your room and house clean. Get rid of cockroaches. Eat well and drink plenty of water. Avoid sugar because that can cause more inflammation. Local raw honey can help because it soothes your throat. Learn to relax. Listen to your doctor and take your medications. Whoa. I thought that was cool. Preventions. Avoid no contributors such as smoking and exposure to smoke and other triggers that obviously I stated. Treat your attack early before it gets out of hand. And learn your body so you know you're at risk for an
there are
asthma
little
attack.
birdies everywhere. Oh my gosh, I just not realized that.
That was my favorite thing.
They're always paying attention.
Wait, where's the birdie on this one?
Finally, a few interesting facts. There are 9 people die from asthma every day. And 1 in 11 children have asthma. 1 in 12 girls have asthma. And black children are 2 times more likely to have asthma than white children.
Look, it's right there.
All right, that's a great job, Hayes. We have to go.
Finally, a few more interesting facts.
Hey, baby girl, that's it. Good job.